Welcome to the OmniDental podcast. Today, we're doing a deep dive into something really fascinating: how digital dentistry is transforming patient care in 2025. It's this amazing space where, technology meets health, and it's totally changing how we think about and experience dental care. We'll also look at how practices like OmniDental right here in Arlington Heights, Illinois, are really leading the charge. OmniDental serves Arlington Heights, of course, but also nearby places like Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, the Plains, and Elk Grove Village. Their commitment to using the latest tech is, well, it's absolutely key to how they put patients first. Our mission today: to unpack the specific digital tools making a difference now and what that really means for your comfort, your convenience, and your overall oral health. Basically, a shortcut to understanding this big shift.
It really is exciting. Things are moving so fast, and seeing these technologies become part of everyday dental work, it's shifting what we thought was even possible.
Okay, so let's start where a lot of dental visits begin. The diagnosis and planning. I think many of us remember those messy, kind of uncomfortable dental molds.
The goop, right?
Oh, definitely the goop.
Yeah.
How is digital dentistry changing that first really critical step?
Well, what's truly transformative is the move away from that physical impression stuff altogether. We're talking about digital scanning now.
Okay.
So instead of those trays filled with, well, goop, dentists use these sleek intraoral wands. They're small, comfortable, and they capture thousands, literally thousands, of high-res pictures of your teeth and gums in minutes.
Wow, okay.
This instantly creates these incredibly precise digital models. You can see them on a screen, twist them around, zoom in.
So no more waiting for that stuff to set.
Exactly. No more gagging, no waiting. But it's more than just comfort. It means much faster and way, way more accurate treatment planning.
More accurate how?
Well, the dentist can see tiny details, things they might miss with a traditional mold. They can spot potential issues right away, look at the bite from every angle. It leads to much more informed decisions right from the very beginning.
So it's not just about feeling better in the chair. It's fundamentally about better diagnosis, better precision and speed.
Precisely. Better data leads to better decisions.
Yeah.
And these digital files, they're super versatile.
How so?
They can be sent securely to a lab instantly. Or, and this is key, they can be used right there in the dental office.
Okay.
And that enables these incredibly efficient solutions, sometimes even getting work done the same day.
Yeah.
It really sets the stage for everything else.
Right, that efficiency that leads directly to something patients must really appreciate: same-day solutions. Tell us about that. How does digital tech make getting things like a crown or a bridge possible in just one appointment? That sounds amazing compared to temporary crowns and multiple visits.
Yeah, this is where computer-aided design and computer-aided manufacturing CAD/CAM systems really come into play. It's pretty impressive stuff.
Okay, CAD/CAM.
So once we have that super accurate digital scan, the digital model, the dentist uses specialized software to design the restoration, the crown, bridge, whatever it is, right there on the computer.
They design it themselves.
Often, yes. Or a trained technician in the office. They can tweak everything, make sure the fit is perfect, check the bite, even get the aesthetics just right with your input. It's total customization.
And then what happens?
Then, once the design is finalized, it gets sent electronically to an on-site milling machine.
A milling machine in the office.
Exactly. It's like a highly precise robotic carver. It takes a block of high-quality, durable ceramic material, matched to your tooth shade, by the way.
Oh, neat.
And it carves out that custom-designed crown or bridge based on the digital blueprint.
How long does that take?
The milling itself, often less than an hour, maybe a bit longer, depending on complexity. The whole process, scan to seated crown, can often happen in just a couple of hours.
So, really one visit.
One visit. You walk out with your permanent, perfectly fitted, natural-looking crown. No need for those temporary ones that can sometimes be uncomfortable or fall off.
Wow.
It saves you multiple trips, reduces the chance of issues between appointments, and you get a better result faster. It's a huge win for patients.
That's incredible for crowns and bridges. But it sounds like this digital approach isn't just for those routine things. What about more complex stuff, like dental implants? Precision there must be absolutely critical.
You're absolutely right. And that's where 3D printing connected to those initial scans plays a really vital role.
Especially for implants.
3D printing in dentistry, how does that work?
Well, think about placing an implant. You need to know exactly where it needs to go, the precise angle, the depth, avoiding nerves, sinuses, all that.
Right. Sounds tricky.
It requires extreme precision. So, using the detailed 3D digital scan data, the dentist can plan the implant placement virtually on the computer first. Then they can design a surgical guide.
A surgical guide. Yeah, it's basically a custom template, often 3D printed right there in the office using biocompatible resin. It fits precisely over your existing teeth or gums during the surgery,
Okay.
and it has a perfectly positioned channel or hole that guides the drill and the implant exactly to the pre-planned spot.
So it's like GPS for the drill.
That's a great analogy.
Yeah.
Exactly. It ensures pinpoint accuracy during the placement.
And the benefit of that is?
It significantly reduces surgical risks. Less chance of complications like hitting a nerve.
Yeah.
It makes the surgery often faster, less invasive, and leads to much more predictable, successful long-term results for the implant. Better outcomes, less worry.
Okay, that level of precision for something like an implant makes a ton of sense. Now, we've talked about the tech, but what does this actually feel like for a patient? Can you give us an example of how this digital-first approach plays out in real life?
Yeah, absolutely. And this touches on how empowering this can be for patients. Let's take the example of Maria P. She was a patient at a clinic that really embraced digital workflows. She needed a crown. Normally, that's at least 2 appointments spread over weeks, right?
Right, with a temporary in-between.
Exactly.
Yeah.
But because the clinic had CAD/CAM, she actually got 3 restorations done in one single session. About 4 hours.
3. In 4 hours. Wow.
Yeah. And she talked about how smooth and comfortable it was. Not just the speed, but the whole experience. She could see her new teeth being designed on the screen, give input on how they looked.
That's cool. More involvement.
Totally. And she was so happy with it, she actually decided later to replace all her old metal fillings with tooth-colored ones. She said something really telling. She said, "It's not a closed-lip smile anymore."
That's powerful.
It really is. It shows how this approach, faster, less invasive, more collaborative, getting permanent results right away, can really boost a patient's confidence and encourage them to, invest in their overall oral health.
That's a great story. So if this is clearly where things are headed, how are dental schools keeping up? Are they training new dentists in these digital techniques?
That's a really important point. And yes, educational institutions are definitely adapting.
Yep.
It's a shift for them, too. Requires investment.
I bet.
Take the University of Pittsburgh School of Dental Medicine, for example. They've set up specific labs just for teaching digital impressions, digital scanning, 3D printing workflows.
So students are learning this from the start.
They are. But interestingly, they're often trained in both digital and traditional analog methods.
Why both?
Because the reality is, not every practice transitions overnight. So new dentists need to be versatile. They need to be comfortable with the old ways, but proficient and ready for the new digital workflows they'll encounter.
Makes sense.
Yeah, experts in the field really emphasize that the goal is to produce dental professionals who are just as comfortable picking up a scanner as they are reaching for traditional impression material. It's about embracing technology to improve care.
Okay, so we've seen digital impressions, same-day crowns, precision implants, the patient experience. Let's pull back a bit. What does all this mean overall for you, the listener, the patient, and maybe for the dental practices themselves? What are the big takeaways?
Well, adopting a full digital workflow brings major benefits across the board. For the dental clinics, it's about streamlining how they work.
Efficiency.
Big time. Increased treatment accuracy, less material waste. Think of all those physical molds they don't need to store, which can lower overhead costs eventually. It helps them run smoother.
Okay. And for the patient?
For patients, the benefits are really tangible. Fewer appointments, definitely less discomfort.
A goop factor again?
Exactly.
Yeah.
And restorations that fit better, look better, and last longer. Dental care just becomes more personalized. You've got clear digital images for diagnosis. You've got computer-aided design for that custom fit, 3D printing for things like those surgical guides.
Right.
The whole process using digital models means shorter waiting times, incredible precision. And importantly, you're more involved. Seeing your scan, choosing shades, previewing results on screen, it builds trust and makes you part of the team.
It really sounds like a fundamental shift towards more patient-centered, efficient, and precise care.
That's exactly what it is.
So bringing it back locally, it's clear digital dentistry offers huge advantages. How does Omni Dental, right here in Arlington Heights, actually use these technologies in their practice every day?
Well, Omnidental isn't just keeping up with trends. They're really committed to leading with this kind of innovation. Their practice is fully decked out, state of the art.
So they have this stuff.
Oh, yeah. They've got comprehensive 3D imaging, the CAD/CAM systems for those same-day restorations we talked about, advanced digital scanning for those comfortable impressions, and they even have in-house 3D printing.
Wow, the whole package.
Pretty much. And these aren't just fancy toys. For them, these technologies are fundamental to how they deliver care. It allows them to provide faster, safer, and just incredibly precise treatment for every patient. Whether it's getting you a same-day crown or bridge so that you don't need a temporary,
Right.
or using those precise surgical guides for placing implants with maximum accuracy and safety. They use these tools to tailor the experience, aiming for the best possible health outcome and the best-looking smile, all with more comfort and efficiency for you.
It's clear how much digital dentistry is changing things, making care more comfortable, faster, incredibly precise. It's really exciting, actually, thinking about how this empowers you, the patient, makes you more involved, more confident in your whole dental journey.
It really does. And, thinking about all this, it raises an interesting question, doesn't it? Well, we see technology moving so fast, transforming dentistry so profoundly, it makes you wonder, what other parts of our lives, maybe other areas of healthcare even, are kind of ready for this type of digital revolution, maybe in ways we haven't quite seen yet?
That is a thought-provoking question to leave people with, something to definitely ponder. And as we wrap up this deep dive, if you are curious, if you want to experience these advancements yourself, Omni Dental is located at 305 E Rand Road, right here in Arlington Heights, Illinois, 6004. You can give them a call at 847-483-8833, or just check out their website to schedule a visit. You can learn more about all their dental and aesthetic services there, too. We really hope this discussion gave you a clearer, maybe even more exciting picture of the future of dentistry. It's certainly moving fast.